Nurse Ira.
And we're your nurses today.
Today we're going to educate you about celiac disease, but first we'd like to assess your knowledge about the disease.
Here are some pre-tests that we're going to hand out that you can go over before our teaching.
Celiac disease is the inability to process foods with the gluten protein that is found in wheat, rye, and barley. It is an autoimmune genetic disease. The disease causes autoimmune reaction and destroys intestinal villi, which equals malabsorption. Normal intestines are on the left. The villi are usually raised and finger-like. The celiac intestines are on the right, and the villi have flattened out and making them unable to absorb nutrients. This disease commonly affects 2 million people in the U.S. This is a disease in which most people don't know or are misdiagnosed because they are similar to other GI disorders like irritable bowel syndrome. The initial classic presentation of celiac disease is an infant that is irritable with wasted extremities, bulky stools, and weight loss or failure to gain weight. Bloating, chronic diarrhea, vomiting, constipation, pale, foul-smelling, fatty stools, and weight loss. Asymptomatic but may still develop anemia, osteoporosis, miscarriage, liver diseases, and cancers of the intestines.
Diagnosis includes blood tests for the anti-gliadin antibodies, anti-endomysium antibodies, transluminase antibodies, total serum IgA, and it's important for blood work that you keep eating gluten foods because a stop in eating gluten-free foods may cause a false negative. But even with a false negative, you can still do other tests such as the intestinal biopsy, which is just done with an endoscope through the mouth, stomach, into the small intestine where a sample is taken. Also, if you have dermatitis herpetiformis, that is a positive sign for celiac disease that occurs in 15 to 25% of celiac sufferers, and it's just a rash on the elbows, knees, and buttocks. And also genetic testing for abnormalities on chromosome 6 can be found.
Management of this disease is easy to remember with this celiac acronym. C is consult your dietitian. E, education on the disease. L is lifelong adherence to gluten-free diet. I, identification, treatment of nutritional deficiencies. A, access to an advocacy group. C, continuous long-term medical follow-up.
Treatment includes lifelong gluten-free diet. So you wouldn't eat any foods with wheat, rye, or barley, or any food with the ingredient with flour in it, such as bromated flour, gram flour, durum flour. There's hidden gluten in licorice, potato chips, soy sauce, candy, sauces, French fries, medications, and lipsticks. So looking at Twizzlers licorice, in the ingredients it has wheat flour. So it's important to always read your labels. You can eat potatoes, rice, soy, amaranth, and quinoa, and you can still eat meat, fish, fruit, and vegetables, which are still a large variety of unprocessed foods. Here's a list of local support groups in your area.